Polio symptoms in children. As a parent, it is essential to be aware of the symptoms of polio in children, as it can be a severe disease. While most people think of polio as a thing of the past, it is still alive and well in some parts of the world. Knowing the symptoms to get your child help if they start showing any signs is essential. In this post by Graham Hadley MD, we will discuss polio and the symptoms to look for. What is polio? Polio is an infectious disease caused by a virus that attacks the nervous system. Polio can cause paralysis and even death. Polio is most common in young children but can also affect adults. Polio is transmitted through contact with infected saliva or feces. Polio vaccinations can help to prevent the spread of the disease. There is no cure for polio, but early diagnosis and treatment can improve the chances of recovery. Polio survivors often have limb paralysis and muscle weakness. According to Graham Hadley MD, getting vaccinated is the best way to protect yourself from polio. Graham Hadley MD's Guide on the Symptoms of Polio. Back pain and stiffness. Back pain and stiffness in children are commonly thought to be symptoms of polio, but they can also indicate other conditions. Back pain and stiffness may sometimes result from an injury or infection. In other cases, they may be caused by a more severe condition, such as juvenile scoliosis. If back pain and stiffness accompany other symptoms, such as fever or weakness, it is essential to see a doctor for a diagnosis. While back pain and stiffness are often benign, they can indicate a more severe condition. According to Graham Hadley MD, it is always best to avoid caution and seek medical attention if these symptoms are present. Neck pain. Neck pain is a symptom of polio, a viral infection that can cause paralysis. Polio is most common in young children, and neck pain is one of the earliest symptoms. Other early symptoms include fever, headache, and vomiting. If these other symptoms accompany neck pain, it is vital to see a doctor immediately. Neck pain can also be a symptom of other conditions, such as meningitis or an ear infection. However, if neck pain is the only symptom, the cause is likely benign, and no treatment is necessary. Neck pain is a common complaint in childhood, and it is usually nothing to worry about. However, if other symptoms accompany neck pain, it is crucial to see a doctor to rule out more severe conditions. Muscle weakness. One of the most commonly known symptoms of polio is muscle weakness. This can affect any muscle in the body but is most often seen in the legs and arms muscles. Muscle weakness can sometimes be so severe that it leads to paralysis. When muscle weakness affects the breathing muscles, it can be life-threatening. Muscle weakness is caused by damage to the nerves that control muscle movement. This damage can be caused by the poliovirus, which attacks these nerves. In mild cases of muscle weakness, the affected muscles may regain full function over time. However, in more severe cases, muscle weakness may be permanent. According to Graham Hadley MD, seeking medical treatment as soon as possible is vital if you or your child experiences muscle weakness. Fatigue. Fatigue can be defined as a feeling of tiredness or exhaustion that is not relieved by rest. In the case of polio, fatigue is caused by muscle and nerve damage. This damage leads to muscle weakness, which can lead to fatigue. Fatigue is one of the most debilitating symptoms of polio, as it can make it difficult for children to participate in activities and interact with others. Fatigue can also hurt mental health, causing anxiety and depression. Graham Hadley MD's concluding thoughts. Although polio has been eradicated in the United States, it is still present in other parts of the world. As a result, it is essential for parents to be aware of the symptoms of polio and to seek medical attention if they suspect their child may have contracted the disease. Thanks for watching.